Thank you so much for coming this afternoon. It's great to have such a big crowd here. As I just mentioned, I'm from family medicine. I'm a gerontologist, primarily a researcher, and I have been back on campus since 1997 and have been involved in many different initiatives over the last 20 years to create a stronger aging presence on this campus. So I'm thrilled to be having this event today. I do want to say thanks to Dr. Gage and Barbara Sawyer-Koch and Katie Hansen and Lori Strom for helping to organize this, and to Jamie, thanks for all your help. The plan is for me to just lay the groundwork a little bit, tell you what we're going to do, and then I'm going to turn it over to some of the researchers on campus so you get a flavor of just, a snippet of some of the research that's happening related to aging. And then, as Doug said, we'll have the opportunity to meet and talk with each other. And I really hope that this is just the beginning of some ongoing conversations. And I mentioned that there is a sign-up sheet going around, so I hope that you'll sign up and that we can try to keep the momentum going and carry the conversations on past this day. I did look at the RSVP list, and I was stunned, really, by the breadth of representation in this room. It's really striking. I counted at least 34 different units from across campus, from economics, English, epidemiology, engineering, medicine, social work, translational science. It's amazing. So I think it really speaks to the way in which the issue of aging cuts across all different identities and affects many of us. I'm grateful that we have several community partners here. So John from Helping Hands and others, because our community partners, and several people said community-based research was part of their 3 words. We can't do that without our community partners. So I'm glad you're here, and the retired faculty and the administrators. I think this is presenting us with a pretty rare and exciting moment for us to be integrating our interests and talking to one another. And we are all here because we do have an interest in aging, whether it's aging research, education, community outreach, or for how it's affecting our own lives personally. I guess I have a clicker. You do. So this is one of the reasons why we are all, or should be, interested in aging. The population is aging rapidly. This is what you're seeing here on this graph. It's aging rapidly in the U.S. as it is in almost all major countries across the globe. And as we know, older adults have a much higher incidence of chronic illnesses and conditions, and consequently have a higher need for long-term care supports and services. And certain diseases, I know we have some people here who are doing Alzheimer's research, some doing Parkinson's research. Some of those, the rate of Alzheimer's disease is rapidly growing. It's rather alarming. And there are major consequences from this aging population that we all have to pay attention to. And one of them is a critical lack of people prepared to provide the kinds of supports and services that are necessary to help older adults. And there's also a shift from institutional care to home-based care. Institutional care the cost of it cannot be sustained. And so we're shifting to home-based care, which is where most people want to be anyway. And then there's addressed a real sharp need for research. We need researchers who are addressing these critical issues. And I think we have an amazing opportunity as Spartans to make a difference, not just locally, but globally with our research. So it may surprise you to see how much aging research is actually happening on this campus. Most of us work in silos, and I heard several people say they had no idea that people were doing aging research in all of these different units. My colleague Katie Hansen there in the back, she and I put this database together and discovered at least 70 funded researchers, and those are PIs, across multiple units on this campus over the past 15 years. And this doesn't even count our community partners, our co-Is, our collaborators. It doesn't count the unfunded research. So we have a lot of graphs. This is just one graph that gives you an idea of the amount of money that has come in because of aging research over the last 15 years. And I think based on these data and the response to this event today, as I said, I think we have an amazing opportunity to create a real aging presence on this campus and for all of us to make a difference in the world. And we are hoping that you will consider several possibilities. I've already mentioned a couple of them. One is to, afterwards, as Doug said, talk to each other. Talk to some people that you don't know that sounded interesting, and pursue some new partnerships. The second thing we would really like you to do is sign up on that sign-up sheet. Let us know how we can, and really, if you have ideas on how to keep this going or what you would like to see happen on this campus, put that on the sign-up sheet too. And then we have a handout of aging initiatives over the last 40, 50 years, and I encourage you to take one of those and think about how we can keep moving this forward. So I'm going to take my last 2 minutes, I promise I'm wrapping this up, Jamie, to mention something about my own research. A substantial portion of my work has been focused on the workforce that's available to provide supports and services for older adults, particularly the direct care workers. I have my colleague here, Dr. Foley, who's interested in the geriatricians. I'm interested in the direct care workers or the personal care workers. And let me see here. So I have some colleagues here today. Hollis was supposed to come, Joe Lardo in the back. We've done a lot of work on developing and testing training programs for direct care workers and what the impact is not only on their knowledge and their skills and their job status, but on patient outcomes. Dr. Foley, Jerry Lindbergh in the back there, we've been putting together an initiative called GROW, which stands for Geriatric Research on Workforce, and we're hoping to position ourselves for research in that area. Another line of research that I'm involved in is art and health. And I've primarily been working with Dr. Marcia McDowell in the MSU Museum and Matrix on several projects. One is funded by NEH, and it's related to digitizing all of the panels of the National AIDS Memorial Quilt, which is shown here. Can you believe that? And we want to examine, I personally want to examine how this database can be used to teach future health professionals about certain conditions like AIDS. I mentioned the Great Lakes Folk Festival here because we will have an art and health presence there. And this year we are featuring panels from the National Parkinson's Quilt. And we're hoping to involve MSU researchers. So if you are doing any research on Parkinson's and would like to be involved in the Great Lakes Folk Festival, please let us know. My final slide here, these images are several quilts that are featured in a book that Marcia and I are writing on quilts and health. And there's a remarkable, moving story behind every one of these quilts. And we have discovered that there are literally millions of quilts being made that are related to health in one way or another, whether it is for fundraising or coping with an illness or public education or to create a healing environment. And there is now also quite a bit of growing empirical evidence of the effect of using quilts in clinical medicine on clinical outcomes. So I'm going to stop there because the dinging is getting much more rapid. But I am going to deviate from the program just a little bit to give Dr. Foley 30 seconds because he has a special request for all of you. And then we will carry on with, I think Sheila Cotton will be next, and our speakers will introduce themselves. But I would like to just once again say thank you so much for being here, and I hope we have lots of opportunities in the future to engage with each other. Thank you.